Okay, prone lying on your front. So you're long from sacrum to crown and from feet to pelvis. Place your forehead on your hands to give you height and also to give you the height of the elbow tips. Float your head, send the forearms away so they're just semi-inclined, and so that your head, face and neck are just floating above the floor, 1 to 2 centimetres. Okay, your first point of attention is the medial epicondyle, the inner elbow tip. So just place attention there and ask, are my elbow tips horizontal? And then from there you can go to the length and width of the forearm, and remember it's an informational point in that you're using the skin and the weight to just know that aspect of the shoulder girdle. Now we bring attention back to the trunk and the spine, and we say, I'd like to take the skin of my spine out to my elbow tips. So that creates the feeling of lifting and lengthening the back ribs, and also lifting and lengthening the curve of the neck. Crown of the head goes away and we find ourselves in the beginning of a nod. So now everything above the diaphragm has been optimised. Now we come to the bony part of the sternum, the chest position, and go inside to the lateral rib wall. And again, just ask for contact. And I'm starting to feel a width and a fullness from inside. And I'm sending that down to my pelvic basin in a wave-like fashion, or like a coffee plunger that's plunging beans down to the base of the pelvic floor. Now, as I get into the lower abdominals and the concavities of the groins, I want to feel full. Okay, from that fullness I come into the space of the kidneys, feel full, and see if I can send the pressure across the border of my pelvis, L5-S1, into my back pockets. So the feeling is the sacrum is going away towards the heels. And the front pelvis has come more into contact with the floor. Now this last cue is difficult to achieve, and if your low back is tight and your hip flexors are tight, as in Jander's lower cross syndrome, you may find it almost impossible to get that feeling.